wanted to drop you a quick video and ask you a question. What's the most dangerous thing a physical therapist, physician, chiropractor, massage therapist, personal trainer can do to a patient? So the most dangerous thing, what is dangerous, and what's the most dangerous thing we could do to somebody who's coming in to see us for help? So let me give you the background on where I'm coming from this, with this story, or with this question. So here's a story about a patient that we saw last week, dancer, and he's got a history of low back pain, history of plantar fasciitis, and his main complaint coming in was that he's got this knee and hip issue going on. So he came in and I looked at his intake, and on his intake it's got that he circled that he's seen the chiropractor, he's seen physical therapy, he's seen massage, he does foam rolling, he does Theragun, he does stretching, all that kind of stuff. So typical dancer thought process. So you get this community that wants more and more motion and more flexibility, and they get tighter and tighter as they seek more and more of that, because the way they're trying to obtain the more range of motion and more flexibility is actually making them worse. So this is the mindset with these people coming in. So I'm already ready for this guy to tell me what I already know he's going to tell me. So get him in, and he tells me about how he has this fantastic physical therapist in a different town, but he's not in that town right now because he's doing a show somewhere. He's doing a show here. And that physical therapist totally got rid of his plantar fasciitis by giving him inserts, and he makes sure that he rolls his feet on a ball daily and does his calf stretches. So I said, okay, put that in the memory bank. And then he's also got, this MRI that shows that he's got fractures in his back, and he's got fractured discs, and all this stuff going on there. And then of course he's got sciatica, and he's got IT band syndrome, but his chiropractor that he was seeing is a fantastic chiropractor, got rid of his IT band syndrome, of course, as long as he continues to foam roll multiple times per day. So here's this guy who's seen 3 different people. He saw for the low back problems, obviously got an MRI and x-rays ordered by a physician who told him that he's got these fractures in his discs. Now, do I think the physician told him that? No, but here's the most important part. It's not what you tell them, it's what they interpret you saying. That's the important thing. So what he interprets this physician saying is, and his MRI saying, is he's got fractured discs and a bad back, and he shouldn't be getting out of lumbar neutral. So that guy's program and way to solve his problem is don't ever get out of lumbar neutral, because that's where your pain is, and that's what's going to break your discs. All right, so let's break down the information that this guy's been given, and more importantly, how he's put this into his memory bank and instilled this into his belief system. So the doctor, the physician, told him that he's got fractured discs, and the only way to keep those from getting worse is to never get out of lumbar neutral. The chiropractor told him that he has IT band syndrome, and the only way to deal with that, and sciatica, the only way to deal with those is to foam roll the crap out of his IT band multiple times a day. And then the physical therapist told him that he's got plantar fasciitis, and the only way to deal with that is to roll his foot on an ice bottle and the orthotics, and stretch his calf constantly. All right. Holy cow, sun just came out. Hold on one sec. Okay, holy cow. Okay, so here's his beliefs. Don't move. Anytime you feel tight or pain, do these things. And then make sure you're doing these things also before you dance and before you do all that kind of stuff. So here's what he's been told. And he believes that he's better, but he's not. He still has all of the problems that he had before he saw those 3 geniuses. He's just doing a bunch of garbage to try to cover it up. And along the way, as he does that, he's actually making himself worse. So he comes in, tells me his story, shows me how fantastic his orthotics are. And as I'm watching him move, he's a dancer, and he literally sits down. When he comes in to sit down, he literally sits down like this and stands up like this and moves like this, because he's got to maintain lumbar neutral, because that's how he's going to fracture the discs in his back. He's a dancer. Do you think he's ever going to be in lumbar neutral? And he's doing shows and musicals and all kinds of stuff. So even if you're not a dancer, you're never in lumbar neutral unless you force yourself to be there. So here's where I come in and say, so tell me, like, what would happen if you didn't foam roll and stretch and ice bottle roll and all that? Oh, well, I'd be a mess. And I said, so actually you're not any better than you were. You have the exact same problems that you had before you saw them. And now you believe all of these false narratives and all this nocebo talk, which is actually keeping you locked in the position that you need to get out of. So I'm going to tell you why those three people are wrong. And I'm going to tell you why. I'm going to demonstrate to you why you're making yourself worse with what you are doing. And then I'm going to give you things to do instead of what you've been doing to actually get better so you don't have those problems.